Clinical examination of the central nervous system. Cranial nerve 12. So the 12th cranial nerve is the hypoglossal nerve, which is a pure motor nerve, and it supplies the muscles of the tongue. So you let the patient open his mouth and examine the tongue inside the mouth. So you look for any sign of unilateral wasting or generalized fasciculation. In lower motor neuron lesion, the affected side of the tongue will be wasted and will show fasciculation. Fasciculation is a continuous, random, irregular contraction of groups of muscle fibers comprising a motor unit, and it gives the appearance of tiny twitches and momentary dimpling of the tongue surface. You let the patient protrude his tongue out. So you let the patient protrude his tongue out. The fasciculation and wasting is again looked for. Normally, the whole tongue moves out with the tip of the tongue in the middle. So in lesion of the 12th cranial nerve, the affected side is not able to move out. The normal side devil moves out alone, and it deviates towards the affected side. So the tongue moves towards the side of the lesion. The patient is then asked to flick the tongue rapidly from side, and a slowness or poverty of movement suggests either an upper motor neuron lesion or an extrapyramidal defect, as in Parkinson's disease. The unilateral lower motor neuron weakness of the tongue is rare and suggests damage to the nerve in the base of the skull. Fasciculation and atrophy of the tongue indicates a lesion of the anterior horn cells, usually motor neuron disease.